Dear colleagues, thank you for joining us today to hear our distinguished panelists talk about the importance of effective partnerships to advance family planning goals. Early in my career, I worked on a program focused on advancing street or homeless children and youth rights in a part of the world where HIV was spreading quickly and at a time when there was no antiretroviral treatment or pre-exposure prophylaxis available. We realized early on that most of the street youth were sexually active, and yet, because of their position in society, were not able to easily exercise their choices on family planning and also exercise their reproductive rights. Initially, the program tried to provide all the services on its own, but we quickly learned that we could not go far down that path. The youth we worked with were mobile and wanted services where they were, not where we were. And so we formed an alliance in the city where we worked with local pharmacies, the regional government hospital, the social marketing agency, and a local NGO clinic to ensure street youth, both girls and boys, could receive counseling and high quality contraceptive services quickly and with dignity. Today, we have come much further and have learned that effectively advancing family planning and reproductive health goals requires working in partnerships. These partnerships take a variety of forms, including formal consortia, informal networks, professional associations, implementing partnerships, and more, and bring partners at every level, at the community, at the national, regional, as well as global levels. In this session, we will be speaking with experienced leaders from different types of organizations and institutions to get candid perspectives on why partnerships are important, how partnerships work, and the unique challenges presented by working in partnerships. We hope all of you will walk away with a renewed appreciation for how partnerships have shaped our community, what makes partnerships effective, and new ideas on how to work through challenges to form the most effective possible partnerships. Without further ado, I would like to introduce our panelists and offer them a very warm welcome. At the top of our panelists is Mr. Hyacinth Ando Kwaku, or Chef Ando as he is known in Cote d'Ivoire. He is the Deputy Coordinating Director of the Mother and Child Health Program of the Ministry of Health and Public Hygiene of Cote d'Ivoire. He has been involved with local and international partners to address sexual and reproductive health issues in Cote d'Ivoire and the West African region for over 20 years. The next panelist is Dr. Belinda Vallandia. She is the Tanzania country representative of the East, Central, and Southern Africa College of Obstetrics and Gynecology, EXACOG. Additionally, she is the former Honorary Secretary General of the Association of Gynecologists and Obstetricians of Tanzania, AGOTA. She serves as a lecturer at the Muhimbili University of Health and Allied Sciences, teaching undergraduate and postgraduate students in the Department of Obstetrics and Gynecology, and practices as a specialist in the University Teaching Hospital. She is a Master's of Medicine in Obstetrics and Gynecologist and has subspecialized in reproductive endocrinology and infertility. Mr. Abede Kebede is the Executive Director of the Consortium of Reproductive Health Associations, CORHA, in Ethiopia since 2016. He used to be the Technical Services Director of Marie Stopes International and served for more than a decade on the National Committee on Traditional Practices of Ethiopia. He has multiple degrees, including a BA, MBA, and a postgraduate diploma in organizational development. With more than 20 years in the area of reproductive health and family planning, he has extensive experience in managing and coordinating projects with different partners. And then finally, Ms. Nene Fofana Sise is the EngenderHealth Regional Representative for West and Central Africa. Nene is responsible for strategic initiatives that support local leadership and networks to develop and deliver sexual and reproductive health and rights programs. She is the chair of the Forum for Contraceptive Security in Francophone Africa, SECONAF, and a founding member of the Francophone chapter for Women in Global Health. Prior to joining EngenderHealth, Nene served in various technical capacities at the global, national, and regional levels. Once again, I'd like to extend a very, very warm welcome to all the panelists and to thank them and all of you who have joined this call for joining. For some of you, it's late in the day. For others of you, it's in the middle of your day. And for many more, it's also early morning your time. And we appreciate your making the time to join this panel. So for the panelists, and I'd like to extend this question, we talk a lot about partnerships in the reproductive health and family planning community. We use that word to describe many types of relationships between organizations and institutions. From your perspective, why are partnerships important to your organization or agency? How have you leveraged partnerships to advance your family planning and reproductive health goals? And provide a reference-specific example where you can. And I'd like to invite Chef Ando to get us started. Chef Ando, over to you, please. Thank you.
Merci à tous. Je voudrais dire qu'en Côte d'Ivoire, depuis à l'indépendance de la Côte d'Ivoire, jusqu'aux années 91, le pays était opposé. Allô, vous m'entendez? Allô, vous m'entendez?
Oui, très bien.
D'accord, donc je disais que depuis la cession de la Côte d'Ivoire à l'indépendance, le pays était opposé à la planification familiale. Et c'est seulement en 1991 que le gouvernement a accepté de faire la planification familiale. Et je pense que c'est très récemment encore que la planification familiale, on a décidé de renforcer cette activité-là. Donc, pour la mise en œuvre de ce document, de la planification familiale, nous avions compris l'intérêt du partenariat et de la multisectorialité. Nous avons compris que l'État seul ne pouvait pas mobiliser les ressources financières, ne pouvait pas avoir les ressources techniques, et c'est ainsi que nous sommes adressés, le pays s'est adressé à l'ensemble des différents acteurs de la société. Et dans ce contexte-là, nous sommes allés vers certains partenaires, dont Engender, qui ont apporté leur appui technique et financier à la mise en œuvre. Et l'appui de Engender s'est traduit par l'appui des projets financés par l'USAID dans un premier temps. Nous avions le projet ICFP et qui a permis de relancer la planification familiale. Nous avions eu ici par la suite, par le biais d'EngenderHealth, par le biais de la fondation Head, nous avions aussi des financements. Ensuite, nous avions eu aussi un financement de la fondation David. Et enfin, nous avions eu des fonds des Nations Unies à travers le mécanisme de réponse rapide du FP 2020. Voilà un peu 4 appuis que nous avons reçus par le biais d'Engender pour renforcer les activités de planification familiale. Alors, dans sa mise en œuvre, nous avions compris aussi que 4 éléments ont été majeurs, c'est-à-dire le repositionnement de la planification familiale. Comment ça s'est traduit? L'appui de ces partenaires a permis de relancer la révision de la loi SR. Il faut dire que notre loi sur la santé et la reproduction constitue un blocage à l'accès de la contraception, notamment limite l'accès aux jeunes de moins de 18 ans. Nous avions aussi, par le biais de ce projet, nous avions renforcé les capacités des prestataires, ce qui nous a permis à intégrer la planification familiale dans tous les centres de santé d'Abidjan. Nous avions produit un outil de plaidoyer, c'est-à-dire l'outil qui nous permet de savoir que nous faisons, si nous nous orientons véritablement dans la planification familiale, nous pourrons avoir des gains à long terme, gains sur la santé de la population, gains sur la santé des femmes, gains sur la santé de l'enfant. Nous allons aussi avoir des gains sur l'éducation, sur l'économie. En fait, nous allons profiter des dividendes démographiques. Et ça aussi, grâce à cet outil, nous avons fait du plaidoyer auprès de toutes les organisations de la société civile. Et nous avions touché aussi les religieux qui ont permis, eux aussi, d'être aussi des vecteurs pour la promotion de la planification familiale. Et je vous assure que toutes ces activités qu'on a réalisées ont permis de booster la planification familiale, ont permis de passer, en 2012, parce que nous avons 2 enquêtes, En 2012, nous étions à 12% de prévalence contraceptive. Aujourd'hui, nous sommes à environ 22% de la prévalence contraceptive. Vous avez vu? Donc, tous ces projets-là, surtout les projets appuyés par Engender, nous ont permis de relancer la planification familiale. Nous avions ensuite élaboré les documents de référence pour la planification familiale, fait le plaidoyer sur la loi. En fait, en d'autres termes, il y a eu encore le réseau des intervenants, c'est-à-dire tous ceux qui participaient, ceux qui œuvraient dans la planification familiale. L'État seul ne peut pas aller jusqu'au dernier kilomètre pour voir les populations. Donc, nous avions utilisé aussi des relais, des ONG qui interviennent sur le terrain. Et ça, c'est par le biais de l'appui que nous avons reçu de Engender. Donc, en résumé, je pourrais dire que sans ces apports de ces partenaires-là, nous serions encore très loin des résultats que nous avons dont je parle de la prévalence contraceptive. Alors, c'est cela que je voulais remercier très sincèrement au nom du ministère de la Santé l'appui que Engender a pu apporter à la Côte d'Ivoire pour relancer la planification familiale. Voilà ce que je voulais dire dans un premier temps. Est-ce que j'ai été compris?
Yeah, thank you very much, Chef Ando. Merci. I'd like to invite Dr. Belinda to provide her thoughts as well. Thank you.
Hello. Yes.
Go ahead.
Thank you very much, Mustafa. As I've been introduced, I am part of the GOTA, which is an association of obstetricians and gynecologists of Tanzania. And this is a professional association that encompasses all obstetricians and gynecologists of Tanzania. And among the objectives, our aims to have this association is to promote, by all possible means, the attainment of the highest possible standards of living and physical well-being of women, and also to oversee the standard of teaching on all the trainings and practice at all levels in the field of obstetrics and gynecology. And we also aim to promote scientific research in obstetrics and gynecology, both locally and in international cooperations. So you see, despite the progress that have been made in our country in the reproductive, maternal, neonatal, and child adolescent health, we still have challenges in meeting some of the health needs of our women and adolescents. For example, the maternal mortality ratio is still very high at 556 per 100,000 live births. But we also have an average of 5.2 children per woman, and only 38% of women are using any kind of contraceptive method. And if you check, the modern contraceptive rate is even lower at 32%. So despite the commitments that the government has made in trying to make these indicators look a little bit better, we still lag. We still have a lot to work to ensure that these indicators are changed. And when you talk about maternal mortality, you also talk about family planning in a way, because most women will die because they have been giving birth too frequently. They don't have a time for the body to recuperate and to replenish the iron stores and the likes. So among the challenges that have been faced is a limited access to family planning, but also some sort of a poor lack or poor distribution of the qualified human resource, for example. So like the National Roadmap Strategic Plan is working to strengthen this reproductive maternal health services in which family planning is part of that. And as an association, we work with the government to ensure that the quality of reproductive, maternal and child health and adolescent health services are improved. Now, this is where partnerships come in. We as a GOTA, we have the technical capacity because we are the obstetricians and gynecologists, and we see women, they come to us when they have their problems not associated with deliveries and pregnancies, but also when they are pregnant. And we have a chance to encounter them oftentimes and talk to them about family planning and provide the family planning services. But sometimes we lack the financial capacity, and of course, sometimes advocacy is not as much as compared to people who are doing this every day. So in so doing, for example, we have worked, I'll give one example of EngenderHealth. We have worked with EngenderHealth in the past to try to map the pre-service curriculum, for example, on family planning teaching. And this included the curriculum for medical doctors, for Bachelor of Science in Nursing, for Diploma in Nursing, assistant medical officers, clinical officers, clinical officers, and also obstetrics and gynecology residents, those who are studying to be obstetricians and gynecology. So the mapping helped to know the problems that were in the curriculum in terms of deficits, both in knowledge and in skills. And with the financial help also, we helped to go through the curriculums, and after seeing the gaps, they were amended. And as we are speaking right now, the curriculum that is available is very strong in terms of knowledge and skills on family planning. So when the students are still studying, this is the pre-service curriculum. Once they go out with enough competencies to make them able to provide these services wherever they are posted to work. We also, together with EngenderHealth, we trained in service, these are clinical officers, assistant medical officers, nurses, obstetrician and gynecologists themselves on Minilab. In our country previously, Minilab was to be done with doctors, those who have competencies to be able to open an abdomen and know where the tubes are and cut. But we do not have enough doctors in all the places in our country. So this was more of like a task shifting in order to give these other cadres the competencies needed for them to do a Minilab. And after that, a short survey was done to try to see if there are any differences between these other cadres and the doctors, and the difference was very minimal actually. So it has helped us to have more people with get competencies to be able to practice and provide family planning services wherever they are. Yeah, maybe for now I end there. Back to you, Mustafa.
Thank you, Dr. Belinda. That was very just very illuminating about the ways in which different organizations have worked with AGOTA in partnership to advance the family planning needs in Tanzania. Thank you. I'd like to switch over to Mr. Kebede for the experience with CORHA. So over to you, Mr. Kebede.
Thank you, Mustafa, for the introduction. Before I go to your question, I would like to give you a very brief background about what CORHA is all about. The Consortium of Reproductive Health Associations was founded in 1995 as an umbrella organization of 74 NGOs and civil societies, both foreign and local, and committed to the provision of comprehensive, integrated, and sustainable outreach and family planning information services in Ethiopia. The ultimate goal is to improve the overall health status and quality of life of all people in Ethiopia, thereby contributing to the national development. Its mission is to create enabling and conducive environment for its member organizations and improve the overall reproductive health status and quality of life for all people in the country. CORA is committed also to organize and facilitate members' work, coordination, representation, capacity building, policy dialogue, knowledge management, and resource mobilization so that we could be able to ensure that members are providing comprehensive, integrated, and sustainable reproductive health and information services in Ethiopia. CORA also acts as a bridge between members, civil society organizations, and government, and strives to enhance partnership among stakeholders to bring impact in reproductive and family planning activities through collective, collaborative, and coordinated manner. Prior to the establishment, there were many actors, as I said earlier, working on RH family planning areas in the country without any coordination, risking duplication of efforts. So CORA gladly chose to play the coordination role and thereby brought a group achievements through optimum utilization of resources, avoiding duplication of efforts and integration of activities to meet common goals. So here comes partnership, which is about inter-organizational relations that are beyond the usual formal agreements or formal kind of relationships. So by establishing partnership with the stakeholders, especially government, civil society organizations, developmental partners, and the public at large, we could be able to strengthen the capacity of the national actors to address reproductive health family planning programs in a sustainable manner and enhance accountability among civil society organizations and gear result-based management towards achieving results in line with national plan and to be cost-effective and to minimize admin and financial costs without compromising accountability or effectiveness and also quality of services. And beyond that, it also complements among stakeholders on the comparative strengths and advantages and contribution of financial and non-financial resources to achieve the jointly planned results, which is coordinated by the Family Planning Technical Working Group, which is led by the Minister of Health, and the partners as well are participating. We, as a civil society organization and umbrella of the civil societies, we also represent a number of civil society organizations working in the area of family planning. So by doing that, we could be able to bring the issue of reproductive health and family planning to the attention of the policymakers, to the government and the general public, to the donors, so that we could be able to set as one of an important development agenda. Beyond this, we can also see how partnership really helps us to improve the identification of policy agendas on relevant evidence-based priority issues, such as domestic resource mobilization for reproductive health and family planning programs. As you may know, any individual organization cannot really make a difference unless and otherwise we could be able to bring all relevant and important stakeholders who can really support us, so that our voice could be heard. So this is one of the areas that we have achieved through establishing the partnership. The other is to facilitate, it's really helped us to facilitate relationships among members, civil society organizations, and share experiences, lessons learned, and promising practices for higher efficiency and effectiveness, and also facilitate constructive dialogue with concerned government ministries, developmental partners, the private sector, civil societies and NGOs and other agencies. We have also, through partnership, we could be able to also link the global commitments such as FP 2020 in Ethiopia, our partnership with the government, which is committed to improve the health status of mainly of the its useful population. So the partnership is expressed by coordinating civil societies in the preparation of the National Adolescent and Youth Health Strategy 2016-2020, in line with the Global Strategy for Women, Children, and Adolescent Health 2016-2030, for a coordinated effort to improve access to modern contraceptives through strengthening adolescent and youth-friendly clinical services, because our members are engaged in different programs. A number of them are providing services, and whereas there are also a number of organizations that are engaged in demand creation or awareness creation. And also a few of our members are also directly working with the government in system strengthening. So this is how we are working, and our umbrella organization is really a hub for the facilitating the partnership among the different actors. Over to you, Mustafa.
Thank you very much, Kebede. That was a really great introduction to Korha and all the really impressive work that you've been able to do over the last 25 years. I'd like to now invite Nene to tell us a little more about how you've leveraged partnerships and the kinds of partnerships that you've entered into on behalf of EngenderHealth in the West and Central Africa region. Over to you, Nene.
Alors, Mustapha, merci beaucoup pour la parole. C'est très impressionnant d'entendre tout ce que les autres panélistes ont déjà dit, et je pense que l'une des choses essentielles pour EngenderHealth, bien sûr, c'est de continuer les partenariats, parce que notre vision ne peut être atteinte toute seule, c'est d'avoir un monde équitable sur les questions de genre. Alors, I think I switched in French without realizing, so je vais parler en anglais maintenant. Sorry about that for the translators, but donc à EngenderHealth, on travaille avec beaucoup de partenaires, différents types de partenariats. On travaille avec les gouvernements, évidemment, Monsieur Ando, ici présent, ainsi que Dr Belinda et les autres ont parlé de ce qu'on fait. Avec les gouvernements, que ce soit en termes d'assistance technique sur des documents nationaux ou des documents de stratégie. On a beaucoup de partenariats sur les questions avec les organisations locales. On travaille beaucoup sur les questions de renforcement de capacité, d'accompagnement dans le plaidoyer, sur les thèmes liés à la santé de la reproduction. On travaille également avec les organisations internationales telles que l'OMS, FP 2020, le partenariat de Ouagadougou, tous ces autres forums qui nous permettent vraiment d'élever la voix, les questions de genre, les questions d'accès à la santé de la reproduction. Et nous sommes engagés dedans, c'est en ligne avec notre plan stratégique. La valeur des partenariats est pour nous vitale. Comme on dit chez nous, quand on est seul, on va vite, mais ensemble, on va loin. Donc, c'est une question de valeur, c'est une question d'engagement, et nous construisons des partenariats basés sur la confiance mutuelle, sur le respect mutuel, sur un agenda commun qui est surtout l'agenda de l'avancement des questions de genre, d'équité du genre liées à la santé de la reproduction, et bien sûr sur la transparence, parce que dans les questions de partenariat, je pense que l'un des points saillants, c'est la transparence. Travailler avec des partenaires qui comprennent ce qu'on veut faire, où est-ce qu'on veut aller, et aussi qui sont tout aussi engagés dans tout le processus. Donc, on a différents types de partenariats. On a eu à faire l'expérience de partenariat avec les organisations de jeunesse qui sont dirigées par des jeunes qui nous ont permis de vite comprendre et de vite donner la place aux jeunes dans tout ce qu'on fait, que ce soit au niveau de notre organisation, mais surtout d'élever la voix des jeunes filles en particulier, sur ce qu'on fait en matière de questions de genre, de planification familiale et globalement d'avancer des questions de genre. Merci.
Thank you, Nene, for that very high-level overview, and I know we'll have an opportunity to get back to you with a few more detailed questions as well. I was reminded by the people who are managing everything on the background, our team on the background, that I forgot to introduce myself. So I'm Mustafa Kudretin. I'm the Vice President of Programs at EngenderHealth. I'd like to do a little bit of follow-up with the different panelists, and I have a question for Dr. Belinda. That you talked about how AGOTA has worked to, as the National Association for Obstetricians and Gynecologists, has worked to develop guidelines and protocols, and then both the pre and in-service curricula for the country. And as part of that process, you worked with partners. You've worked with partners ranging from the government to international NGOs, to local NGOs, and to local health providers. And I'm sure that each one of those partners must have very different definitions of success. So as AGOTA, how do you navigate those varying interests? How do you make sure that each partner brings their best capabilities to the table without creating overlap? And then how do you make decisions when partners don't always agree? And I'm sure there are many moments where partners don't agree. So if you can give, again, a specific example to illustrate your point, that will be very helpful for the audience as well. Thank you.
Thank you, Mustafa. Okay, thank you. Yes, creating overlap. So first of all, in terms of navigating in situations like that, I think the first thing that we have always been doing is for us as an association to have a clear understanding of what we want to do in a certain period of time. And this is taken care of by our strategic plan, because the strategic plan has strategic objectives that we want to follow for the next, let's say, 5 years. And once we have a partner who wants to work with us on a certain area, the first thing that we do is to see if whatever their objectives, their goals are, they align with ours. If they align with ours, it makes everything easy. But if they don't, we don't immediately push them aside. We sit down and decide together what we can do together for the benefit of the women of Tanzania. And in so doing, we meet halfway so that we are on a common ground and all of us benefit out of that. Trying to avoid overlap sometimes has been a challenge. As you said, people may have different definitions of their success. So maybe this partner, when they were writing their proposal, they have not included us as part of that proposal. So when they come to us, they already have their own ways, the things that they wanted to do in Tanzania. Even though at the end of the day, maybe they would want to see their contribution in reducing maternal mortality in Tanzania, but how they would want to do it may be different. I'll give an example that was not directly related to family planning. There was a time we had a partner who wanted to work with us in the area of, they wanted to impart skills in treating emergency conditions in obstetrics. And what they wanted to do was to train healthcare providers in some part of Tanzania on the training that is called alarm training, which will give people skills in how to manage emergency conditions. But as some of you may know, maybe in Tanzania, we have what we call comprehensive emergency obstetric care training. This kind of training gives our health providers skills in how to manage emergency obstetric care conditions. So if we were to agree with them to use the alarm training, it will be like confusing providers on what they should follow. So we sat down with them and looked at the content of the training. So in the end, actually, the training that they were to give to our providers in terms of the content and the competencies was basically the same as the comprehensive emergency obstetric care training that is being given in Tanzania. There were just a few issues in terms of how to conduct the training. This would have meant that if we were to agree with the alarm training, it would have meant the obstetrics or the obstetricians from their country were the ones to come here and partner with us, of course, and to train the providers. But if we were to use the CMOC training, it means the AGOTA members who are the obstetricians in Tanzania were enough to provide that kind of training. But we sat down and agreed that we do not need the alarm training because we will be introducing something different in a way, but already it's there. So after agreeing on that, we continued with the CMOC training. And we invited, of course, some of the obstetricians to be part of this training so that we can also learn from each other. So in the end, we trained together, but we trained the training that that is being conducted in Tanzania. That is also accredited by the Ministry of Health of Tanzania. So this is how we try to avoid overlaps in situations like that. And when partners do not agree, of course, it can be difficult at times. Oftentimes we come to a common understanding, but once in a while, you may find a partner who is not willing to to sit down and see how you can sort of customize something and make it more of Tanzanian context. So there was a time where I will not mention any names of the partners. There was a time, this was a not so good one, where the differences we had made us terminate that project altogether. Yeah, it's like that. Thank you, Mustafa.
Thank you. I'm sorry, I know I posed a difficult question for you and you answered it really well. I'm sure there's much more to what happens behind the scenes in making the partnerships work, and your explanation around the importance of aligning your mission with what the partners want and making sure there's alignment there, I think is very, very important and helpful to hear. But also really appreciate you sharing some of the examples that are not great. I think too often in our industry, we talk about all the successes and not always where we weren't able to meet. So the example you're giving is really helpful as we all look towards strengthening and working even more in partnerships towards 2030 and beyond. I'll turn over to to a different panelist right now and switch to a question for Mr. Kebede. That you mentioned in your talk that KORHA is a consortium. It's working to link the work of the member associations, the CSOs that form KORHA, and then also work very closely with international consortia and work with the national government. Can you say a little more about the importance of KORHA or of consortia in our sector? And then how does the work of KORHA at the national level in Ethiopia connect to the international work of FP 2020? So if you could share a little more about that, that would be fantastic. Thank you.
Yeah. Thank you very much, Mustafa. Before that, I would like to mention just one point. how we are working with EngenderHealth. EngenderHealth is also a member of CORHA, and currently the board chairperson is EngenderHealth as organization. So the head of the organization is a member of the consortium. So just to mention about it. Regarding how important we are in terms of, you know, the partnership, especially in bridging the civil societies with a global, consortium or networks, and also with the government, we have different platforms. First of all, I would like to explore what we're doing at the national level and then go to the global platforms. At the national level, CORHA is a member of the HPN Donors Group, Health, Population and Nutrition Donors Group. And we are the only civil society representatives in that platform. So we can share information, what is the intention or the overall direction of the donors community, so that we communicate to the civil societies that are working in the area of reproductive health, family planning, just in a very specific area, not all the health programs. And in our service, within our service, what we did is we subgroup our members into 4 thematic areas. That is 1 in family planning, HIV and AIDS, adolescent to sexual reproductive health, and also maternal and child health. So that, you know, organizations, they came together, they set agenda, and the members are the one who really chairing these thematic groups. So they discussed issues, you know, on quarterly basis. Sometimes if there is an urgent need, you know, they can come together and meet for, you know, kind of an extraordinary meeting. So they really see, you know, assess what is really currently at the global level, at the national level, which area of priorities, you know, to be considered, so that, you know, they come up and intervene in the most needy areas of interventions that really need the intervention or the support of the civil societies. Beyond that, as I mentioned earlier, very briefly, there are technical working groups led by the Ministry of Health, where the civil societies and other partners like the private sector and also the government come together and discuss on the issues and developments of family planning programs. So there is a family planning technical working group, and CORHA is serving as secretary. So set agendas with the ministry and discuss among the members of the technical working groups and share the developments, the challenges or the achievements, or what really expected from each civil society, so that we can come together and intervene for a better result. So not only for family planning, but also for other technical working groups, CORHA is serving as secretary, so that we set agendas and share the outcome of the meetings. There is also, with the Ministry of Health, there is a plan alignment kind of approach. So the ministry just put the plan of the national plan and share it among ourselves, and we share it to our members. So every organization is expected to align its plan with the national plan, so that you know, we really encourage the civil societies to align their plan with the national plan. This is really very much helpful, as you may be familiar about the health sector transformation plan. You know, this 5 years transformation plan, there were a series of meetings, you know, to give inputs and comments and feedback on the plan. So we coordinate the civil societies to participate in those platforms. Beyond that, we are serving as a focal person or a focal point for FP 2020. CORHA, representing the civil societies from the donor community, USAID, and from the United Nations, UNFPA, and the ministry is the one who will lead the FP 2020 focal point. So we really facilitate the opportunity to share global experiences to our civil society organizations, even sometimes beyond our members, because we are also serving as a national focal point. So we also go beyond our members. So this platform is really help us to really understand what is really going at the global level, and also learn new lessons, experiences, and so that we also see where our country is in terms of the family planning programs, what we have achieved, what are the challenges, this kind of thing, so that we could really learn from our successes and our failures, so that we can always be dynamic in terms of running the family planning program in Ethiopia. Not only the FP 2020, but we are also working on the GFF, Global Financing Facility Platform. There is an Ethiopian focal point here in Ethiopia, the Global Financing Facility. This Global Financing Facility is the same structure. We represent the civil societies, the World Bank, and the Ministry of Health, and also from the Ministry of Finance. These are the focal points, the organization serving as a focal point. So we are really trying to share, the country-led program partnership committed to ensuring all women, children, and adolescents can survive and grow up and lead a healthy life. So in this kind of engagement, we really share the experiences like the FP 2020 experiences of other countries, and also see, the different developments regarding like how the developmental partners plan, in terms of supporting the civil societies, and the main thing is how can we really make the government accountable, to the resource they got from the government gets from the World Bank and other funding agencies. So this is also one platform that we are engaged in, and in all the process, we highly mobilize and encourage our members to take part and contribute, so that this kind of engagement that we have with the global as well as a national level. Over to you, Mustafa.
Great, that was really, really comprehensive and a fantastic response. And I think my overall takeaway from the very rich information you shared was just how CORHA as a consortium is leveraging both the power of the consortium to advocate, but also to ensure that the programs that the consortium members are implementing are in alignment with the overall national strategy, and then are also contributing to national strategy. And I think that's a wonderful way of describing how this larger partnership works. And then also how you've then also divided into thematic areas to share, to progress along multiple fronts on reproductive health issues in the country. So thank you for that sharing, and really appreciate it. I'm going to switch over to Nene, and to switch to a different kind of partnership. And Nene, under your leadership, EngenderHealth has developed and implemented some fairly non-traditional partnerships in West and Central Africa. Can you tell us a little more about the work that you've done with youth-led initiatives around access to information and services, organizational development, and funding? And why did you choose that direction? How are the partnerships structured? Are they less formal than partnerships with other organizations? And in what ways have those relationships helped you achieve EngenderHealth's goals around gender equality, around access to reproductive health? If you can share a little bit about that. I know I'm packing a lot of questions under one
That's
roof.
5 questions.
But if you can just kind of give us a big picture, that would be great. Thank you.
All right. No, thank you. Thank you for that, those 5 questions, Mustafa. I think EngenderHealth desire to work with partners stem from the belief that working in collaboration actually foster innovation, and it's one of the main ways in which we think that we're going to be disruptive in the SRH space, especially as it relates to gender norms and gender roles. So we believe that you know, partnerships, especially with youth-led organizations, are key to reach our objectives. And, you know, in the West and Central Africa Department, we've been working to create and foster those partnerships. So beyond what we do with the government, with other civil society organizations, we've decided intentionally to focus on youth-led and especially youth, women-led organization and individuals. And we've started that in the past 2 years through several projects and several activities we've done with these organizations. So we've worked in the digital space with youth bloggers, organization and both individuals. We've worked with young feminist activists. We've also worked with young religious organization led by young people. So we have a wide range of youth partners from which we've seen not only innovation come, but also different ways of conceptualizing the SRH problems that we've seen, from, you know, access to services, to access to information, to you know, advocacy. And we've been able to experience firsthand not only their capacity, their agency in leadership, their ability to take forward some of these issues and bring them to decision makers, but also their ability to change the reality on the ground in terms of, you know, peer-to-peer education, or, you know, educating others, you know, parents, other populations that we think sometimes youth will not be a good interlocutor, good people to talk to. But it was interesting to see that the dynamic changed. So it was different type of collaboration, I believe. But what we can say from all of this partnership, especially our experience in the digital space, was that in our region, it's a growing space. So it was interesting to work with young people. It's a thriving space. They bring a lot of energy and a lot of experience, contrary to what people think, a lot of experience in doing some sort of online SBCC. So being able to address social norms, to address lack of information around family planning, to address stigma and rumors around family planning or other sexual reproductive health areas, and being able to bring that awareness. It was also very interesting to work with them to raise awareness around sexual reproductive health rights, especially with young women, because there's a lot of awareness issues around what rights are and what they mean. And so the work with the young bloggers in Cote d'Ivoire specifically, for example, amplifying the voices of young women around SRH was very interesting in that sense. There was a lot of learning from that project. And in working with young organization, we also were able to work with youth-led organization in mass media, in the radio space, in the TV space, and even in the print paper space, because they bring that experience that, as I say, they have a different voice, they have a different tone that resonate with people, especially with young folks. And maybe one thing to note is that the vast majority of countries, especially in West Africa, have more than 60% of their population that are considered in the youth category. So that, you know, it totally makes sense to give them the space to do that. The other thing, I guess, we've seen in this partnership, and I think the experience that is interesting for us, is that they were able to not only bring this different approach to the messaging, to the advocacy, for example, in the advocacy space, but that we've also seen that they come into this partnership in the idea of synergizing. So working with youth-led initiative, youth-led group, one of the things we've noticed is that there's competition, but we felt like there was less competition than working with another INGO, for example. Of course, it's not the same stakes, but one of the things we've seen is that collegiality and trying to find synergy was of interest, and it was something that they pursued actively. So we had experience, for example, very interesting experience working with a youth-led religious organization called OSEF, Organisation pour la Santé de la Famille et de l'Enfant, in Côte d'Ivoire. And that organization didn't want to work on all the entire range of SRH issues, but wanted to focus on family planning specifically. And as they started coming into working with EngenderHealth, understanding the issues better, understanding the breadth and the realm of what SRH means, that organization was more engaged around fistula, was interested in learning more about other topics. And so that also give, that experience to the organization. And I feel like that's where the partnership is really key. It's not only for EngenderHealth to work with the organization and leverage what the organization has to offer, but it's also for us to bring in technical expertise to increase their breadth in terms of what they can do or what is out there in terms of SRH, and ensure that their voice is heard where it needs to be heard. So we've cross-pollinized recently in the SRH and gender space. One of the things we've noticed in our gender work, especially working with young feminist organizations, was that they were working in silo from the SRH organization. So the GBV issues, although there are judicial implications, there are medical implication, there are policy implications, sometimes are taken in silo from SRH implications such as HIV, family planning. And, we've been working closely with this organization to bring them, as I said again, to the breadth of everything that is out there and how they can, beneficiate or from working with EngenderHealth on GBV, but also from other organizations such as Les Jeunes Ambassadeurs working on SRH. And it's been an interesting experience for us to bring into this partnership traditional partners such as the SOGOC, for example, the OBGYN Association of Côte d'Ivoire, to have them work with young feminist organization on GBV and, being able to throw FP in that mix. For us, it's a learning experience. We are learning as we are evolving. It's not a formal partnership in the sense where we write MOUs and everybody has an assigned role. But I think we're getting to the stage where we are formalizing some of these experiences. It started as a discovery. It started as a need that arose from talking to different organizations in the country, in all the countries, and it's now becoming a network, I believe. One of the things we've done recently around the 16 days of activism against GBV was to organize similar events with GBV activists in Côte d'Ivoire, Mali, Benin, Burundi, DRC. And it was mind-blowing to see how some of the, not even some, a lot of the challenges are similar, but the solutions to the challenges are contextual and different. And having that opportunity to share among people in the same country, but also across countries, was a need that quickly arose and on which we are working forward with some of the groups we are in partnership with. So the partnership started informally, I can say, but I think it's more and more becoming formal in the sense where we know some of the issues we want to work with. So that's why I believe, I mentioned earlier that a common agenda is important when you build a partnership, especially with youth-led organization. Some have different interests, which is fine, but we need to have a common agenda so we have the same ground. We're starting off of the same ground. Of course, trust was something hard to establish, especially when you wanted to, we wanted to bring in government partners or other partners in which sometimes they've, maybe they've tried things with them and they didn't get heard the way they wanted to be heard. So there was some sort of discouragement, and we had to emphasize the need to work in in the government, within the structure of the country and within the policies of the country. And to do that, you have to work alongside with government. But it was interesting to build that trust and be able to bring all of these partners together. The other thing that we've learned along the lines and that we're still working on is, of course, the openness and the transparency in all the processes. Youth-led organization or youth-led initiatives sometimes have either been victim of lack of transparency or do not always grasp what it means to be fully transparent. So we work with them to ensure that it's clear and, you know, everything we do is aligned with that transparency from the beginning. I guess I will close by saying that for us, it's a learning experience. It's an awesome experience. It's a work in progress, as in the sense that what we hear from the groups is that, oh, it's different from just being a sub on a project, or it's different from just being an implementing organization with an INGO on a project. It's really a sense of working on a common agenda to achieve a goal. And that goal is gender equality, it's SRH, it's clear. And the way we get at it might be different, but at least we're working together. And we had great feedback on that. Over to you.
And thank you for the kind of fantastic summary you gave at the end as well around the importance of. I think my biggest takeaway here is the importance of listening and being ready to adapt and to not fall into a formal structure right away, but to allow the process to unfold and then to respond accordingly. Perhaps as a segue to what you just said and to the point that you made around building trust, especially when engaging with government institutions or connecting youth-led initiatives with government institutions as well. I'd like to ask Chef Ando for his opinion on recognizing that you know, we work very closely. You work closely with, you said earlier as well in your talk as well, that you work closely with other organizations in order to achieve family planning goals. Would you be able to give more specific examples of organizations you've worked with, and that perhaps more importantly, what would be different if you did not have these kinds of partnerships with, and not just with INGOs, but with, well, with the donors that you mentioned, the youth-led initiatives that Nene spoke about as well, that what would be different in Cote d'Ivoire if these kinds of partnerships were not in place from the perspective of the government or from the perspective of the Ministry of Health? Thank you. So over to you.
Merci bien pour la question. Je le dis déjà dans mon propos que sans ce partenariat, nous n'aurons pas pu obtenir les résultats. Je voulais avant tout situer que nous avons travaillé avec Engender, nous travaillons aujourd'hui avec Pathfinder, nous travaillons, et ça c'est les ONG internationales. Nous travaillons aussi avec des ONG nationales qui sont l'IBF et l'IBF, l'IMAS et tout autre. Donc, quand nous regardons le ministère de la Santé, notre rôle, c'est de fournir les services et d'éduquer les populations. Mais il arrive dans des contrées pour lesquelles le ministère ne peut pas avoir accès, ne pourra pas avoir accès. Et donc, c'est dans ce cadre-là que nous cherchons des ONG pour intervenir. Il y a aussi des interventions, comme par exemple de l'Engender, par exemple, où les fonds disponibles pour l'État ne seront pas suffisants pour atteindre aussi, développer des interventions dans certaines parties de la Côte d'Ivoire. Et c'est aussi là l'intérêt de ces partenaires-là. Donc, tout à l'heure, j'ai parlé de Pathfinder, qui lui nous appuie à mettre en œuvre les activités sur la planification familiale dans le postpartum, dans la zone de Agnébi. Nous avions d'autres partenaires, mais qui interviennent de façon directe. C'est-à-dire, nous avions par exemple l'UNFPA, qui lui n'intervient pas sur le terrain, mais apporte son appui soit au gouvernement de Côte d'Ivoire, c'est-à-dire au ministère de la Santé, soit directement par une ONG dont l'IBF ou autre ONG. Et donc, il y a ces partenaires. Il y a aussi l'OMS qui intervient aussi par le biais soit des structures du ministère ou des ONG. Donc, vous voyez que le partenariat se fait au niveau du ministère de la Santé et de certaines entités. Alors, ces partenaires-là, ce que nous avons pu avoir d'eux, comme je l'ai dit tout à l'heure, c'est la capacité de ces structures à mobiliser de certaines ONG, à aller dans les zones où le gouvernement ne peut pas avoir accès. Et c'est ce que nous disons tout le temps. Si nous prenons par exemple le financement des partenaires qui transitent par le biais de l'IBF, c'est ce qui nous appuie quand le ministère de la Santé développe ses actions. Mais je vous dis qu'il y a des populations qui sont très éloignées des services de santé qui ne peuvent pas avoir accès. Et c'est cela que nous apprécions ces appuis-là. Maintenant, si nous revenons un peu à ce qui a été fait, ce n'est pas uniquement dans les zones de l'Abidjan, nous avons parlé de Engender, qui nous a permis d'avoir intégré les services de planification familiale dans tous les centres. Mais sans cet appui, nous n'aurons pas pu. Nous savions que 97% des structures d'établissement sanitaire aujourd'hui offrent la planification familiale, offrent au moins 3 méthodes de contraception. Ça, c'est déjà un résultat positif. Mais nous voulons aller loin. Nous voulons atteindre 100% des établissements sanitaires qui offrent au moins 5 méthodes. Voilà quelques objectifs que nous signons. Et nous assignons au moins. Mais nous pensons que ce résultat ne peut être atteint seulement pas par l'État, mais avec l'appui des partenaires. Et tout à l'heure, vous avez posé la question à comment on appelle, Belinda, comment nous arrivons à travailler avec ces partenaires-là. Chez nous, ici, nous avions développé des plans stratégiques pour la santé de la reproduction ou pour la santé de la mère et de l'enfant ou pour la planification familiale. Et dans ces plans stratégiques figurent leurs objectifs et les interventions que nous voulons faire. Si un partenaire qui vient à nous, qui a ces interventions, nous regardons si est-ce que ces interventions cadrent avec les priorités du gouvernement, donc de ces plans stratégiques. Si nous cadrons, que nous nous rendons compte que ça cadre et que ça rentre dans sa vision, alors nous demandons aux partenaires dans quelles sont les zones de Côte d'Ivoire, du pays que vous voulez intervenir. On nous situe dans une zone et à partir de notre cartographie des intervenants et des interventions, c'est-à-dire qu'on a développé un logiciel, enfin, un fichier Excel dans lequel nous avions intégré tous les centres de santé et comment on appelle, les milieux communautaires. En ce moment, dans chaque centre de santé, nous demandons quel est le partenaire qui intervient et quelles sont les interventions que le partenaire soutient. Et ça, nous avons dans un fichier Excel. Alors, quand vous voulez aller dans une zone, alors nous regardons à notre cartographie des interventions. Est-ce que votre intervention, le partenaire qui vient, est-ce que ces interventions ne sont pas mises en œuvre par un autre partenaire? S'il y a juxtaposition, s'il y a deux partenaires, un partenaire qui était là et un autre qui revient pour la même activité, alors nous recommandons à ce nouveau partenaire d'aller dans une autre zone. Si les interventions sont complémentaires, alors nous demandons aux deux partenaires d'intervenir dans la même zone. Donc voilà un peu le mécanisme. Mais à tout cela, il faut des rencontres de coordination. Si vous n'avez pas de rencontres de coordination, tout ce que nous faisons là, c'est voué à l'échec. Parce que chaque partenaire doit savoir ce que les autres partenaires font. Le ministère de la Santé doit savoir ce que tous les partenaires font. Et c'est à ce titre-là que nous pouvons faire d'abord comptabiliser toutes les interventions qui sont faites sur le terrain et ensuite apprécier les effets que ces interventions vont donner. Donc, ça pour vous dire que nous apprécions vraiment la contribution de tous ces partenaires et nous souhaitons aussi en même temps une meilleure collaboration avec ces partenaires. Il arrive malheureusement que des partenaires arrivent, mais ce n'est pas encore le cas de EngenderHealth, mais il y a d'autres partenaires qui arrivent dans le pays, qui vont sur le terrain, commencent à travailler avant même que nous apprenions qu'ils sont en train de travailler dans le domaine de la santé et de la reproduction. Donc, chaque fois, nous invitons l'ensemble des partenaires à venir vers le programme, à ce qu'on analyse leur intervention et qu'à la fin, on puisse comptabiliser. Donc, et ça aussi, nous savions que si ces partenaires n'avaient pas été là, il y a beaucoup d'interventions qui n'ont pas été faites. Il y a beaucoup de populations qui n'auront pas eu leurs besoins satisfaits. Si aujourd'hui, la Côte d'Ivoire a environ 25-26% des besoins non satisfaits en planification familiale, ça veut dire que l'offre, jusqu'à ce jour, les populations ne sont pas suffisamment informées, les services de santé ne sont pas encore à la disposition et les relais communautaires n'ont pas encore joué leur rôle fondateur véritablement. Donc, c'est pour vous dire qu'il faut nécessairement l'appui des partenaires, aussi bien techniquement et financièrement, pour que nous puissions obtenir nos résultats. C'est ce que je voulais ajouter.
Great. Thank you, Chef Ando. And I think your response is very appropriate. I think the highlighting the importance, the role the ministry plays in coordination, ensuring that services are reaching those who are hardest to reach, and that there is equitable distribution of services around the country, I think are really critical. And then the additional role of making sure partners are learning from each other, and that the ministry plays in evaluating the effects of different partner interventions, I think is fantastic. And I think I speak for all of us both on the panel as well as just globally about how important it is when ministries play this function and play it well. Because all of us, I think, ultimately aim to reach as many people as possible with reproductive health services, and the best way to do that is when we're acting in a coordinated manner. We have a number of questions that have been raised by participants, and thank you for posting them on our on the Q&A section. And yet, unfortunately, our time is not in our favor. So we're choosing one question initially, which is a difficult one, and I'm going to be asking all the panelists to respond. That one of the questions that has been raised is that when we bring money into a partnership, we tend, without realizing that we're doing this at times, we tend to have a differentiation in power. So how do we build on the relationship of power, of partnership, and how do we build true partnership when money is involved and yet we want to have shared decision-making power? I suspect that many of us on this on the call today are struggling with this, and I'd like to hear panelist observations of that. So I'll ask Dr. Belinda Kebede, Chef Ando, if you would be willing to respond. And then we'll hold off on you until a little later. Because we are often, as EngenderHealth, we're often in the position of having the money. So we'll hold you off and ask folks who have been on both ends of this equation. Over to you, panelists, and whoever wants to speak can get us started, please. Thank you.
Yeah. May I reflect, Mustafa? Just
yes, please go ahead.
Yeah. In terms of resource, for example, in the GFF platform, as you may know, the financing of health remains a challenge in most countries, especially in developing countries. And in that case, it really sometimes affects the partnership with the government, because we are supposed to really hold governments and donors accountable for the level and use of funding allocated to health. So we don't really see transparency from the government side, intentionally and unknowingly. When we say intentionally, because they don't want to really be accountable, because the people are not very much aware of it, because they always it's always done by the finance team. So you don't really see such kind of challenging the budget department or the budget within the ministry, so that they could really allocate a sufficient budget to the health program. I see this kind of situation, or this kind of gap between, regarding the finance. It's always, really the part, or aside, be a challenge to our partnership. This is one important area that we have observed through the experience. So we always advocate, especially CSOs, for more resources for the public health, mainly for SRHR programs. And we want to really get involved in the process and influence the national priorities. So in terms of setting the priorities, the government usually, especially from the health sector, are not really very much committed for SRHR. So there is always a struggle between, you know, this kind of when we are not on the same page for the setting priorities for SRHR programs and other health programs. This is also one of the areas, especially when a conflict arises, when unrest is happening in a country or some disasters, human and man-made disasters, all the attention is given to other health programs. And usually the SRHR programs are compromised or neglected. This is also, you know, that really related to the financial or the resource that really spoil or sometimes uncomfortable of our partnership with the government. So, and sometimes we also challenge them because we always say we have to really oversee the health expenditures and monitor how resources are spent at local level. You know, this is, you know, you don't see any kind of openness or transparency, not only from the Minister of Health, even from the Minister of Finance. Even that you don't see transparency between the Minister of Finance and the Minister of Health. You know, one thing that we have observed is there is really a gap in terms of, you know, on the challenge on the budgeting or allocating sufficient budget to the health program. So this is a very crucial. And the other is because all civil societies are on the same level. You see, there are like a few of our members, for example, are more influential than even the consortium when it comes to resource. So they are always be heard than even the voice of, you know, those the voiceless, like, you know, many civil societies are not especially struggling to survive. So those who have, you know, in a better position in terms of human resource, financial resource, material resource, you know, they can easily influence and manipulate whatever they want. But in fact, for the sake of, you know, the overall benefit of the people, but sometimes, you know, priorities are compromised and the voice, the level of influencing also sometimes compromised. This is what we have observed in terms of resources. Thank you, Mustafa, over to you.
Great, thank you, Kebede. That was a fantastic response. And I wanted to invite Dr. Belinda or Chef Ando if they had other insights about what happens to partnerships when money enters the picture. Chef Ando?
Oui. Oui, merci. Je voulais dire que par rapport aux ressources que nous recevons, nous devions avant tout considérer que ces ressources que nous recevons sont des ressources pour résoudre certains problèmes de la société. Donc, nous devions faire de ces ressources pour que les interventions que nous allons mettre en œuvre soient efficaces et efficientes. Ça, c'est la première condition. Avoir des ressources, c'est bien, mais pour des activités efficaces et efficientes. Deuxième, la redevabilité. Nous ne pouvons pas avoir de ressources sans pouvoir rendre compte de son utilisation, sans pouvoir faire le suivi des interventions. Et ça aussi, voilà des critères. Intervention à haut impact, efficacité, efficience, suivi et redevabilité. Nous pensons que si nous avions des ressources et pour lesquelles ces ressources sont bien gérées, ces ressources ne pourront pas, et ça aussi le gouvernement doit se rendre compte, ne pourront pas régler tous les problèmes de la société, mais vont pouvoir faire des interventions dont l'esprit serait la pérennisation. Donc, on développe des interventions avec les ressources des partenaires, mais l'État doit s'approprier pour qu'on puisse passer à échelle. Donc, nous en Côte d'Ivoire, on ne s'attend pas, on s'attend à avoir des financements, mais nous disons qu'à partir des financements et des interventions que nous avons menées, nous voulons que l'État saisisse de ces opportunités pour passer à échelle. Donc, voilà ce que je voulais dire sur ces ressources. En résumé, il faut que ça serve à des interventions efficaces, il faut que ça soit efficient, il faut que ça soit redevable, c'est-à-dire que la structure qui met en œuvre, dont le gouvernement fait une redevabilité, rendre compte de l'utilisation, faire le suivi des interventions et à partir des résultats que nous avons pu obtenir, passer à échelle sur l'ensemble du pays. Voilà ce que je voulais dire.
Great, thank you, and very well put. Dr. Belinda, I'd like to invite you. I know you've been itching to share something as well, but if you can be brief because we're running out of time, and I know that the kind of main ICFP event is going to be starting at 8. So if you can be brief, that would be great. Thank you.
Well, thank you, Mustafa. What I wanted to add to this is that, like for us, AGOTA is a professional association. So we are reaching the technical capacity of, when you're talking, let's say, of family planning, we are reaching the technical capacity. So the partner will bring in the money, and that does not mean that this partner has all the power to this program that we are going to do. So initially what we normally do is we set down clear roles for each one of us, so that it's not like one will have more power as compared to the other. So we set down clear roles, as this partner will be responsible for 1, 2, 3, 4, 5, and the other one will be responsible for these ones. And we conduct quarterly meetings to see that each one is doing what they are supposed to do within the required time frame that we have set for ourselves. And this way, the balance of power is actually 50-50. It's not like one will have more power than the other. Yeah, that's all.
Great, thank you, Belinda, for sharing your insights as well. And I'd just like to thank everyone who's been on the call for sharing, the panelists, for sharing all of your insights, answering my many questions inside one question, and doing it so well and so elegantly, and pulling out the theme around partnerships. I think you've been very honest about some of the difficulties that we experience when we engage in partnerships, but also have been wonderful at sharing what the power of partnerships can be. I'd also just really like to thank the audience for hanging in there with us for the last hour and a half following this conversation, asking some fantastic questions. Would like to apologize because of time, we were not able to get to all of the questions. However, we've taken note of the questions, and if you can provide us with your contact information, we will reach out to the individual panelists and ask them to respond to your questions as well, to make sure that you don't feel that we did not get back to you on those particular questions. But the questions were all really good, and we just picked out one that we could ask all the panelists as well.